Is taking lisinopril really the best way to lower your blood pressure? And could it be hurting you more than it's helping? I'm going to share with you everything you need to know about lisinopril so you can decide if it's the right medicine for you. And don't worry, I'll make everything really simple and easy to understand. First of all, what is lisinopril? Lisinopril is a type of medicine that your doctor may prescribe for several reasons, and we'll look at them one by one. Your heart relaxes to let blood in, and then it squeezes to push blood out into your arteries and around your body. And it does this over and over again, all day and all night. When you check your blood pressure, you'll get two numbers. For example, 100 over 70 millimeters of mercury. Millimeters of mercury is what we use to measure pressure, the same way you use miles or kilometers to measure distance. The upper number tells us the pressure in your arteries when your heart is squeezing and pumping blood into these arteries. And the lower number tells us the pressure in your arteries when your blood is relaxing or not pumping. Your blood pressure can't be zero, assuming you're still alive. There are several things that can affect your blood pressure. One of them is the arteries themselves. Think of your arteries as a series of pipes carrying blood from your heart to every part of your body, and your heart is the pump. For your pump and these pipes to work properly, the blood needs to flow smoothly. But if the pipes tighten up, you can't get enough blood to flow through these pipes, and pressure builds up. In the same way, your arteries can become narrow and the force inside them goes up. When this force reaches a certain level, then we say you have high blood pressure or hypertension. This causes a lot of problems. First of all, this high pressure wears down and damages the inside walls of your arteries. It puts a lot of strain on your heart because if the pressure in your arteries is already high, your heart has to generate more force to pump blood around the body. Eventually, this can cause the heart to stop working. How does lisinopril work? Your body produces a chemical called angiotensin, and its job is to tighten your blood vessels, which increases your blood pressure. Lisinopril works by blocking the enzyme that makes angiotensin. Without angiotensin, your blood vessels can relax and open up, and this makes it easier for blood to flow, and this lowers your blood pressure and reduces the strain on your heart. Your heart, which is busy pumping blood around your body, also has its own blood supply that feeds the muscles of the heart. When blood supply to the muscle is cut off by a big clot or a buildup of fat inside an artery, then the heart muscle can't get food and it can't get oxygen. So the heart muscle starts to die. This is what we call a heart attack. After a heart attack, your doctor may put you on lisinopril for up to 6 weeks. And here, lisinopril does several things. It widens the arteries so that you can get more fuel and oxygen to the heart muscle, which helps your heart to work better. It reduces the risk of having another heart attack, and then it helps to prevent the heart from failing completely, which sometimes happens after a heart attack. Another place where lisinopril can be useful is in your kidneys. There are certain problems you can have where your kidneys stop working properly. This is common if you have diabetes, if you have high blood pressure, or heart disease for a long time. Lisinopril helps to improve the blood flow to your kidneys, which helps them to work better. In this way, it's being used to protect your kidneys. You might see lisinopril under other names like Zestril or Prinavil, or when it's combined with water pills like you have in Zestoretic. These are just brand names for the same medicine. Whether you're taking the brand name version or the generic non-branded version, they work exactly the same way. How do you take lisinopril? You usually take lisinopril once a day, and the best time to take it, that's really up to you. Many people take it in the morning so that it becomes part of their daily routine. Others prefer to take it at night, especially if it makes them a little bit dizzy when they start taking it. What matters most is that you take it at the same time every day. You can try setting an alarm on your phone or using a pill organizer, and that can help you to, stay consistent. You can take lisinopril with or without food. It doesn't affect how the medicine works. And what happens if you miss a dose? If you remember later in the day, you can go ahead and take the missed dose. But if it's already close to the time for your next dose, just skip the missed one and stick with your regular rather schedule. The important thing is not to double up. Don't take 2 doses at the same time. Otherwise, you could lower your blood pressure too much and you start feeling faint and dizzy. One thing you need to know is that blood pressure medicines don't cure the root cause of your high blood pressure. High blood pressure is a sign that things are going wrong in your body. If you don't correct those things that are wrong, you can't just stop taking your blood pressure medicine because your blood pressure has come down. What will happen when you stop? Your blood pressure will go right back up again. There are some medicines and supplements that can affect the way that lisinopril works. These include medicines for pain like ibuprofen and aspirin, antidepressants, nitrates, medicines for an enlarged prostate gland, and also medicines that calm down your immune system like cyclosporin. And then medicines that make you pee more, that's water pills or diuretics like furosemide. Medicines that can increase the amount of potassium in your blood, like spironolactone, and then potassium supplements, trimethoprim, heparin. And then also steroid medications like prednisolone, allopurinol for gout, some medicines for diabetes, and lithium for mental problems. Lisinopril doesn't work overnight. You might notice some improvement in your blood pressure within a few days, but it may take weeks to see the full effect. So let's talk about potential side effects. Like any medicine, lisinopril can cause side effects in some people. Most of these side effects are relatively mild. The more serious side effects are quite rare, but when they do occur, they can be life-threatening. The most common side effect of lisinopril is a dry cough that just refuses to go away. It's not harmful, but it can be really annoying. If the cough is mild, you might decide to just live with it, but if it's interfering with your sleep or your daily life, talk to your doctor who may switch to a different type of blood pressure medicine. Another common side effect, especially when you first start taking lisinopril, or if your dose is increased, is that you might feel dizzy or lightheaded, especially when you stand up quickly. This happens because as lisinopril lowers your blood pressure, your body needs time to adjust. So to prevent this, just stand up slowly from sitting or lying down. If the dizziness doesn't go away after a few days or it becomes severe, then you definitely need to tell your doctor. Other common complaints while taking lisinopril include tiredness, headaches, and stomach discomfort. Now we come to the rare but very dangerous side effects of lisinopril. The first condition is called angioedema. This is where you have swelling, especially of your face, your lips, your tongue, and your throat. When you have swelling of your throat, air can't pass through. And this can happen at any time if you've just started taking it or after taking it for years without any problems. So if you have any signs of swelling or difficulty in breathing, rush to the hospital. Lisinopril can sometimes cause your potassium levels to go up. This can lead to signs like muscle weakness, a slow or irregular heartbeat, and numbness. Your doctor will likely monitor your potassium levels with blood tests to make sure that your levels don't go too high. But to avoid problems, just don't take potassium supplements for a start, And then don't use these salt substitutes because they're usually high in potassium. If your kidneys aren't working properly, in some cases, lisinopril can make it worse. And signs to look out for include reduced urination or swelling of your legs. Some common questions I get asked about lisinopril. Can I drink alcohol while I'm taking lisinopril? Yes, you can, but it's best to limit how much you drink. Alcohol can make the dizziness, the lightheadedness much worse, especially if you're just starting lisinopril. And then again, if you have high blood pressure, you shouldn't be drinking much alcohol anyway. How long does it take for lisinopril to start working? You might notice some effects within a few days, like slightly lower blood pressure, but it can take a few weeks to get the maximum blood pressure lowering effect. So just remember to keep checking your blood pressure at home. Do I need to avoid certain foods if I'm taking lisinopril? Be careful with foods that are high in potassium, like bananas, because lisinopril can raise your potassium levels. How long can I take lisinopril? Lisinopril is made to be used for a long time, and many people have used it for years. Can I exercise while I'm taking lisinopril? Absolutely. Exercise is a great way to improve your heart health and lower your blood pressure. Just be mindful of how your body feels. If you notice dizziness or lightheadedness during or after exercise, take a break. And if it persists, you might need to see your doctor. What if I feel tired all the time on lisinopril? Tiredness is a possible side effect of taking lisinopril, especially if you're just starting the medicine. But this usually gets better as your body adjusts. If the tiredness doesn't go away or it really affects your day-to-day life, then you may need to talk to your doctor. They may adjust the dose or suggest some alternative blood pressure medicines. How will I know if lisinopril is working? Basically, if you check your blood pressure, then you can track whether it's going down over time. And then again, you may notice you have fewer symptoms like headache, dizziness, and fatigue.